The next series of muscles are going to be the groin muscles. Typically people refer to this area on the inside thigh as the groin. These are adductor muscles. So when you look at the midline, okay, and you're going to add the leg to the midline, it's going to have the AD or adductor names to it. I call this series the PAAAG muscles. P, AAAG. Okay, the PAAAG, P, AAAG. And this is in order from top to bottom as we look at the muscles. Okay, so the first one we will look at is the P, the pectineus. Okay, it goes from the origin on the pubis and its insertion on the femur. Okay, its action is going to be adduction. Okay, this next one is a little hidden, so if you look closely right there, the first A of the triple A in PAAAG is the adductor brevis. Okay, the origin is the pubis and insertion is on the femur. It does have a little bit of a posterior attachment on the femur. That area is called the linea aspera. The action is adduction. Okay, the next one is the adductor longus. Its origin is the pubis and insertion on the posterior aspect of the femur on the linea aspera, about halfway down, so mid-shaft on the femur. Action is going to be adduction, and it's going to help with some extension at the hip as well. Okay, the third of the PAAAG or the AAA muscles is the adductor magnus. Okay, big muscle, so therefore the word magnus. Okay, its origin is on the pubis and the ischial tuberosity. Posterior view here, you can see ischial tube. And then the insertion is on the posterior aspect of the femur, on the linea aspera, and the adductor tubercle on the femur. Okay, right here. Action is adduction and extension at the hip. Because of its location, hamstring injuries are sometimes misdiagnosed. So in other words, the hamstring is fine. It's the adductor magnus that's